So I'm here to introduce Deborah Dam O'Brien, and she has one of the longest titles on the sheet today, which is, I love it, Executive Director, DePaul Housing Management, McCluskey Community Services Corporation, and Catholic Charities Housing. So welcome, Deborah.
When I worked in state government, the first Governor Cuomo, God rest his soul, used to talk to us all the time about doing more with less. Then I came to work for the church, and that's why I have that long title, because I have 3 different organizations that we're all connected, but are different companies and work together. We in Catholic Charities are very glad that the AHI team reached out to us and asked us to share some information about Bridges Out of Poverty. And in one of those titles that Megan shared, our Catholic Charities Housing Office, we very much are working with these concepts, and our main mission is really to provide housing and support to people who have been homeless. And so we've been doing this for 40-some years. Recently have learned that we're a key social determinant of health, whether people have housing or not. Also, our Catholic Charities programs in Schenectady, New York, have been very involved, and our staff there very involved in a significant community-wide effort to embrace the Bridges Out of Poverty model and really start to create some transformation in the county and primarily the city of Schenectady. And so that's what brings me here before you to talk a little bit on behalf of Catholic Charities and our participation in Bridges and on the Bridges model. And Megan talked a little bit about cultural competence, and I think that's a little bit too of where this fits. And when we talk a little more about Bridges, you'll see why I say that. The Bridges Out of Poverty program really offers us a vision and tools that can help individuals and community organizations address and reduce poverty in a comprehensive way. Bridges brings people from all economic classes together to build resources, improve outcomes, and support those who are moving out of poverty. The program grew out of the work of Dr. Ruby Payne, who, as an educator, wanted to improve student achievement by providing faculty and staff with concrete strategies and tools for helping students from poverty achieve success in the classroom. Dr. Payne and her colleagues soon realized that working in the schools was one thing, but that since schools are part of communities, entire communities needed to be part of the solution. Kind of part of the theme we're hearing today. And so Dr. Payne, with her colleagues Phil DeVole and Terry Drucy-Smith, wrote this little book, Bridges Out of Poverty, Strategies for Professionals and Communities. The Bridges Out of Poverty model is one approach that can help all of us who do not live in poverty day in and day out understand what it is really like to be poor. It helps to give us the perspective of people living in poverty, or as Bridges would say, people living with fewer resources or who are under-resourced. And these are the people who are our employees, our partners, and the people we are serving and whom we will serve. Bridges hopes to help us realize that people who are navigating the complex and difficult waters of poverty may not have economic resources, but they do have other resources in the form of skills and abilities that help them survive and grow each and every day. And that if we engage differently with people who are economically poor and recognize and help them to recognize their skill and ability resources, they can be much more effective in acting to improve their lives. and thus we become much more helpful to them in their effort to do just that. The Bridges model strives to change our understanding of not only poverty, but also economic class as the beginning of an effort to develop a longer-term strategy that involves an entire community in building economically sustainable communities for all. The model encourages us to see that only when we base plans for addressing poverty on the premise that all people are problem solvers can we hope to have success. It also helps us to think about poverty in a broader sense. Megan talked a little bit about some of these things. Bridges 2 posits that poverty exists when a person, institution, or community is without resources. There are many reasons why the person, institution, or community may be without resources, including social disparities or inequalities like gender, race, physical ability, health. So addressing poverty becomes more about working with all to remove the barriers that can be removed, and then to use the resources available to benefit the entire community. Again, Bridges is based on the idea that a community's health and success is dependent on participation by all. Certainly, there can be many political and philosophical discussions about some of the Bridges themes, assumptions, and approaches. But a few of the aspects of the Bridges approach that have resonated in communities, and I've particularly seen resonate in the Schenectady community, are these. We all have a lens through which we look at economic issues, and we don't always fully understand how that lens shapes our thinking, and that lens is different depending on where we sit in the resource picture. Our society generally operates on middle-class norms that can be difficult to follow when you are under-resourced. Wonderful, helpful services can become burdensome, difficult to use, and sources of stress rather than assistance when we fail to understand the realities of living with fewer economic resources. Individuals living with fewer resources are problem solving on a daily basis at a level that we with more economic resources often don't recognize or even understand. Community services and programs that have the laudable goal of helping people with fewer economic resources live healthier lives and lives of more dignity may at times fail to recognize the skills, abilities, and strengths of the very people they are designed to help. And so to make this a little bit more concrete, I'm going to share 2 examples. Ellis Medicine in Schenectady assumed the operations of a clinic program for the poor and uninsured. There were many, many challenges. But one recurring challenge was the failure of people to be on time for appointments or to keep appointments. Employing the Bridges model, the hospital and clinic leaders followed the path of a patient coming to an appointment at the clinic. They started from the section of town where many of the poorer patients live. For those of you who know Schenectady, that's the Hamilton Hill section of Schenectady, and relied solely on public transportation as the means to get to their appointment. And based on this experience, their approach to the problem changed. They found that if you don't have the resource of a car and rely on the bus, you are not in control of the schedule. Weather becomes a factor, and on the day this group went, God must have wanted to be part of this because it poured rain. Weather is a factor since the bus does not stop in front of your house or even in front of the clinic. And if you have little children well, you can start to get the picture. So for the leadership at Ellis Medicine, understanding the significant effort people make to get to their appointments by experiencing that, and the things that delay or frustrate the goal people have of making their appointment on time, led them to different thinking about how the clinic operates. They changed the entire appointment process, and how communication goes with a person or family who is late for an appointment. In addition, Ellis Medicine leadership also started talking differently with community providers who are serving under-resourced people. Schenectady has a group of providers that have come together in a community crisis network for people who are in crisis. And lo and behold, Ellis said it would be to everyone's benefit, including the hospital and the metrics it needed to mean, if they started a shuttle that would be able to carry people and transport people from some of these locations that were social services agencies where people in crisis were going for help. Another story, and this is now about an employee kind of story, and maybe something for the workforce committee to be thinking about. I recently heard the story of a woman who worked in a hospital system in another state, who had worked there for many years, all in minimum wage jobs. She is a single mother with 2 children, receives no child support from the fathers. She lives in an ancient mobile home in a very rural area. Because of the age of the mobile home, she pays no rent, but pays very high bills for utilities. The mobile home has no insulation. She manages to have her children appropriately cared for each day, and her supervisors confirm that she never misses a day of work. She applied for a job in a community health information program established by the hospital, a program whose work is engaging low-income people in the healthcare and health insurance systems. She met the minimum qualifications for the job. She interviewed well. She was the supervisor's choice for the position. But her background check revealed that she had several citations for driving her car without car insurance. The HR department, based on their appropriate rules, told the supervisor that this indicated a lack of good judgment on the woman's part and did not recommend the hiring be made. In Bridges' terminology, we can again see the operation of the different lenses we have because of where we sit economically. This woman could not afford to pay the car insurance, but she still saw the importance of getting to work each and every day. She did not have other options for getting to work each and every day. She made a reasoned decision based on her responsibilities and reflecting her priorities for her family. She made the decision that keeping her job and doing her job were more important for her family than the consequences of intermittently driving without car insurance. I'm not saying driving without car insurance is a good thing. However, if we look at this behavior with her lens and from her perspective, we can see that this is a woman who, rather than merely having poor judgment, has some significant reasoning skills and clarity about priorities and responsibilities. Certainly, Bridges and its model do not give us the answer to poverty, or for our purposes, a blueprint for improving the health outcomes of people living in poverty. Yet today, we have been talking quite a bit about how we all can work together, health, social services, community organizations, to really bring people together and help to make our communities better. Rachel spoke passionately this morning about collaboration. Colleen shared her enthusiasm for collaboration and for seeing some of the goals of her early career come to fruition. So in this context, what Bridges can do is help all of us better understand what it means to live on a daily basis with fewer resources, and how changing our understanding and perspective helps us see more clearly the problem-solving skills people have. And in doing that, we can work together to achieve the goals we all share and live our lives with dignity. Thank you, and I hope some of you will take advantage of Bridges.